In facial rejuvenation, restoring volume is fundamental. For a successful treatment, it's therefore essential to have a safe, easy-to-use product. Aliaxin SR produces excellent results because it contains a quantity of hyaluronic acid cross-linked at 90% and 10% of natural hyaluronic acid. With this formulation, we can obtain, on the one hand, good duration of the product and volumetric capacity, and on the other, thanks to the natural hyaluronic acid, excellent hydration and toning up of the skin. The patient I'll be treating today is a 75-year-old woman. By using Aliaxin Shape and Restore, I'm simply going to regenerate facial toning while enhancing the volume, aiming above all for a natural aspect, avoiding any excess volume which might seem unnatural in relation to the patient's age. What I'm aiming for is global facial toning, so the goal is not that of a filler, but rather a remodeling of the area. I'm mainly going to be working on the malar and cheekbone areas, as well as the mandibular region. I'm also going to tone up the temples, where a bit of volume has obviously been lost due to reduced temporal muscle tone. Let's mark the areas of the patient's face to visualize the points we have to work on. I'll be working mostly on the malar area, right here, to firm up this area. We're going to soften the cheekbone area. Then I'm going to work on the mandibular area to raise and restore the contour to this part of the face. Finally, I'll treat the area around the temples, a very particular area. Having identified the temporal ridge and the zygomatic arch, I'll recreate a harmonious volume within this area to restore fullness to the lateral part of the temples. The treatment in this area is performed quite deep into the temporal muscle zone, while over the rest of the face, the treatment with Aliaxin SR will be quite superficial to take advantage of the product's shaping action, thanks to the natural hyaluronic acid, which has a high moisturizing action on the subcutaneous tissue. In using Aliaxin SR, the concept is to create a layer, subcutaneously, to obtain a remodeling and a stretching effect. So the aim is not that of a filler, that's to say, swelling or filling in the depressions, but rather to remodel the face in a homogeneous manner. The treatment is carried out at a relatively superficial level to create a smooth layer from the malar area to the cheekbones. As you can see, I'm working at a very superficial level precisely because I want to take advantage of the hydrating action of the natural hyaluronic acid in the product. The treatment is carried out very gradually, softening towards the cheekbones to create a smooth reshaping effect in this area. Following the same concept, I'll now treat the mandibular angle, which is very important, thus restoring contour and firmness to the lower part of the face. Here again, we need a very homogeneous superficial treatment to take advantage of the product's remodeling action in this area. So as I mentioned, when using Aliaxin SR, the concept is to inject at a superficial level in order to take advantage of the product's hydrating properties. The objective of this treatment is to be homogeneous in the distribution of the product, and remember it must be superficial to make the most of its hydrating and the product needs to be applied towards the cheekbone with the aim of creating a very smooth and harmonious balance over the face. I'm carrying out a full face treatment to shape the whole area, from the cheekbones and to the mandibular area. I'll use about 2 milliliters of product per side, but I must emphasize that we're carrying out a full face treatment. The patient must be aware that the final results will be obtained a couple of days after the treatment, when the product's moisturizing action will have had maximum effect. Here it's also a purely superficial treatment to tone up the area. It's very important to remind patients to massage their faces in the first 24 to 48 hours to obtain an even distribution of the product in the subcutaneous tissue. The treatment of the temporal area is very important for facial aesthetics because temporal muscular atrophy often creates an unnatural, not very appealing depression in the lateral area. It's of great importance for facial beauty to restore this volume. It's quite a particular treatment which should be carried out very carefully, injecting the product quite deep, thus avoiding the surface vascular network. Personally, I prefer to reach this area from the hairline and inject the product deep. During the injection, it's important to stay deep and continuously massage the area being treated. After the treatment, I advise massaging the areas very well to spread the product through the temporal region in order to properly distribute the product. The temporal region is a very important area from an aesthetic point of view, and so restoring volume in this area is a fundamental stage. The treatment is deep. and aims to restore the volume and firmness to the temporal muscle zone. I've just finished the treatment, carrying out full facial toning of both the cheekbone and mandibular regions on both sides, and restoring the volume and toning up the temporal area. The maximum result will obviously be obtained in a couple of days, when the natural part of the hyaluronic acid will have absorbed its full quota of water.